The autoimmune conditions basically are the autoimmune, where the immune system itself is not really protecting the body from the pathogens, right, from the invaders, but they are actually attacking the different organs of the body. However, at the same time, when you're seeing the autoimmune conditions, there is, depending on the age of the person, if they're a little bit older, then the hormonal deficiency causes the autoimmune condition to actually get worse or look like they're worse, because they're adding the complications of the hormonal imbalance is being added to the autoimmune condition itself. So the other thing about this is that adrenal gland is a part of the immune system, which is a hormone. The adrenal gland produces 3 different types of hormones. One is the cortisol, the other is DHEA, and the third hormone is called aldosterone. So all those 3 hormones play a big role. At least the DHEA and the cortisol definitely plays a big role in the immune system of the body. So there is usually people who get autoimmune conditions are also under a lot of stress in their life itself, and that stress changes the adrenal gland hormones. So as part of the autoimmune evaluation and treatment, we always look at the adrenal gland function as well as thyroid function and the ovarian cycle function. So because they work together, so we have to make sure the hormone system is also fine-tuned and is balanced, so that a person is not being affected because of those symptoms itself. The autoimmune condition itself, we will look at different parts of the autoimmune condition, see why the person is getting this particular problem. And as far as I have seen in my practice, what I see is that there's 4 major reasons of why anybody would have autoimmune problems. And one of them, number 1, is the most common, is food allergies. People eat foods that they are allergic to, including the synthetics, the pesticides that they eat, and then the synthetic hormones that they eat via the meats and things like this, or preservatives. There's several ways of getting this, these synthetics and the chemicals in your body. So when a person is having food allergies, they can have problem with the autoimmune condition. The second common reason for that is chronic viruses. Lots of people have viral conditions that they don't know they have, and they suffer for a very, very long time, and they just don't know why it is that they have a Hashimoto's condition, for example. So we test them for several different viruses to see what is present, and most, I would say 1 for 1, we find always that there is some virus in the background of this autoimmune condition. Number 3 reason for anyone to have an autoimmune problem is heavy metals. So people have heavy metals through their food, the water, the air, environmental toxins. There's just different ways that you can get heavy metals. And some people will retain the heavy metals more than the others. Usually, if you see 2 people exposed to the same amount of toxins, one will be retaining more than the other. So one person may be able to eliminate them easily from the body. The other person may not. So those contribute to autoimmune conditions. And the number 4 is the stress. So lots of people are under a lot of stress these days. Even driving down the 101 could cause a lot of stress. So that's another factor. So that stress links to the hormones, and the hormones are changing because of that. So we basically handle both sides of the equation, and we actually have the person balance their hormones and then handle whatever the cause of the problem is for that particular patient.